I'm I'm Director of Information Management Technology at the Luton and Dunstable NHS Foundation Trust. We have a best-of-breed approach to our electronic patient record, which means we have to join up multiple systems with different functionality. For example, a correspondence store and an ordering and results system and a PACS system and a PAS system. So it's very difficult. The information is spread across multiple logins and multiple patient selections. So acceSSOnce allows you to cut those delays from the workflow. So you only log in once and you only select the patient once.
acceSSOnce as a solution that allows clinicians to free their desktops from the PCs, which allows them to roam around the hospital taking their desktop with them. It allows them to have fast access to those PCs, giving them single sign-on and clinical context, which allows them to search for patients once and all the applications come along with them. When a clinician walks up to a PC, they insert their NHS smart card and log in. Their desktop's delivered to them within a few seconds. Once they've got their desktop up on the screen, they then can launch the applications and they're automatically logged into those applications. They don't have to remember any usernames, any passwords. When they're inside the application, they search for patients normally. However, when they search a patient using acceSSOnce, all the applications they've launched will also search for that patient automatically behind. If the clinician then walks to another machine and inserts their smart card, their same session in exactly the same state will move to that machine.
So since we've had single sign-on and you can go in and you can just change user, it's absolutely fantastic and saves probably 5 minutes every time it happens, so much better. The other issue that we had when we had sort of machines on the wards particularly is that we did have generic logins, and so in terms of governance and security it was appalling because everybody was using the same login, so you couldn't actually track who'd done what.
I have about 7 or 8 passwords at least. I've got passwords for databases within the hospital, and unfortunately that can be quite frustrating remembering the number of passwords that we do have to.
We get approximately 400 password resets a month, and they can vary between network accounts and also the various different clinical applications that we support. It should literally reduce our password calls that come through to the service desk by at least 90%. Session assistants should give the consultants more time to work or be with the patients, either spend with them or see more within their clinic times. At the moment, sometimes the clinics may be delayed because the applications won't launch, or they're unable to get the right correspondence from an application because it just is taking too long to load.
I think the ability to sign in as yourself and get back to your own session immediately, it saves several minutes every time you do it, and that really mounts up during the day, so I think that it makes life a lot easier than it used to be.
acceSSOnce means that actually while we're away from the ward, away from desktop computers, we might be in a non-teaching environment where there isn't desktop computers available, then we can pick up results, we can continue to manage patients where we're waiting for results to happen and to come through. And by having a portable tablet means that as soon as the results come through, we can access that information.
We would see acceSSOnce as integral to our remote access solution, so that clinicians from home who are on call could support their junior colleagues in particular and access electronic stores of information, electronic systems to be able to review charts, results and help the junior team manage the patients from an off-site location.
acceSSOnce will benefit the NHS because it provides just more than one benefit. It's just the fact that they can access their sessions remotely. They can move from place to place with the session persistence. They can capture patient demographics and flow and access their data easily and efficiently, and spend more time with their patients, working with them and helping them rather than worrying about what the technology is doing behind them.
And I think it would help allay some of the problems that clinicians often see in IT solutions, and it's not uncommon to hear clinicians say, but that's going to take longer. And I think this is one thing where you can genuinely say, well, actually no, this is going to save you time.
it's made my time more efficient while I'm around in the hospital. I certainly can get a lot more done while I'm on the go.
I had some cynicism about the ability to deploy Windows 8 so early and the ability to bring the application vendors with us. I mean, I thought they would be quite resistant, or we'd have compatibility issues that might frustrate us. But I think in the end, the solution has delivered above our expectations. I think it's a solution that's fit for the 21st century healthcare in terms of ease of deployment and ease of use for the end user.